Good evening, everyone. It's really a privilege to have this particular series started on this auspicious day, and that too when the college is celebrating the Silver Jubilee functions. Uh, I welcome all these eminent speakers, the delegates who have joined in so large numbers, and we are still pouring up with the registrations. And I'm really glad that with the support from our management and the community department has really worked hard in order to gather up a series, and the series is really wonderful. I I'm thankful to all the eminent speakers uh, within the state, out of the state, right from Ashok Patil, Sir, Basavaraj Madam, Radhika Madam, Radha, Sham Ganveer, and Manisha Rathi. There are so many N number, all eminent speakers here. And dear students, you really will have on the weekends a rich menu of and a very good academic feast on all these community topics which are essentially part of your curriculum also. So I wish all the best for this uh, unique web series which is starting up. All the best.
Thank you so much, sir, for the kind words. May I request our Executive Director, Mrs. Manika Sangvi ma'am, to kindly say a few words to our dear audience.
Hello, a very, very good evening to all of you. It's my proud privilege to once again welcome all of you, and I want to congratulate the entire team for putting up a great series of this webinar. And I wish that they do many more such activities. And all the best, the entire team and all the participants. And with this, without taking much time, I'm going to announce as this webinar series to be open. All the best. Thank you so much.
Thank you so much, ma'am, for your support and guidance. May I request our Joint Organizing Secretary, Dr. Suroshri ma'am, to kindly say a few words.
Good afternoon, all. So first of all, quickly, I would like to thank our Executive Director, Manisha ma'am, for being supportive for every new venture of Sancheti College of Physiotherapy. I would like to thank our Principal, Sir Vivek Kulkarni, sir, for being enthusiastic and for all his constructive feedback. I would also like to thank our community department for taking up new initiatives for making teaching and learning expand in community as much possible. And yes, Venu Mohan sir, Neeraj sir, and our technical team for the support, the biggest support in new normal. So with this, we begin with the first talk of the webinar series on geriatrics physiotherapy. Our speaker is Dr. Apurv Shimpi, sir. Dr. Apurv Shimpi is MPT in Community Physiotherapy with Geriatric Physiotherapy as his primary field of specialty and also holds a fellowship in Orthopaedics and Sports Physiotherapy from USA. More than 15 years of experience in geriatric health and has been affiliated to various centers for the aged. He has more than 25 research publications in peer-reviewed index journals and has been invited as a speaker for various symposia.
Thank you, Dr. Suroshri. Well, we will start with our first session for the day. Uh, we are talking in terms of the paradigm shift to healthy aging. As you said, we are celebrating the National Senior Citizens Day. And this is an event where we are talking from not just aging, we are talking in terms of healthy aging. Okay? So when we are talking in terms of healthy aging, why is there a shift? Why is there a need to change these components? We all know that the population age in the present century is changing. We are having more fitter population. we are having more better population, and we are having more better elderly. A country like India, there are huge number of people, and the number of elderly, which were from somewhere around 7.7% in around 2001, have now changed to around 8.14%. We will have the next census in 2021 to understand how much is the change more. Now, when we are talking in these particular components, the projected census over the next four census, that is in the next 40 years, we can see the numbers are quite huge. Now, as we all say, or rather as we all as physiotherapists always say, that we are adding not just life to the years, but we add, sorry, we do not add the years to the life, we add life to all these years. So having healthy and fit senior citizens or elderly is one of the prime demands of our nation. We again understand that as we grow older, there is a reduction in engagement in physical tasks and activities. WHO 2010 census says that physical inactivity in elderly is the fourth leading cause of morbidity and thus mortality associated with aging. Okay, and this is something where we as physiotherapists can do a lot of tasks or a lot of active involvement which is possible from our end. And that is the reason why promotion of healthy aging, promotion of movement, promotion of mobility is what we as physiotherapists need to definitely focus on. Well, why is there this change? We all know that as we grow older, there are automatic new physiological changes that happen. There are changes that are there in the musculoskeletal system, neurological, cardiorespiratory system, metabolic system. So by the age itself, the population is at a predisposed risk of developing chronic diseases. And with this, unfortunately, there is an associated disability. The second thing is the mindset that our elderly carry. Means in our country, it's a general concept is, okay, now I'm 60, I'm retired, I will sit on a chair, I will be relaxed, I'll just watch TV. The factor of mental retirement itself retires a person from the physical domains and thereby limiting the aspect of physical components. Now, we all know that the health of an individual, especially even for an elderly individual, is depending on multiple factors or multiple domains. As a physiotherapist, we look at the physical functioning. Of course, this is very important because how we move, how we function, our strength, endurance, mobility, all these factors are extremely important from our point of view. Equally important is the mental functioning, especially for an elderly individual. Because see, we have to understand one thing when we are dealing with an elderly, that they have something that we don't, and which is called as the fear of death. We all know right now in the COVID era, I mean, we all are a bit tense, scared, and we also know that the elderlies are more predisposed because of the associated factors. So mental functioning, which is associated with this, is actually a more challenging domain. But the least looked at domain or the kind of neglected domain from all of us is the environmental domain. Being in the community physiotherapy department, we generally emphasize on the environment, that is the contextual factors to a great extent. So we look at a lot of domains, the economic situation of an individual, their ability to participate in the particular domain, the society's attitudes or norms. Elderly, rather when we are young or when they were young, they were at a position, they were at a what we call productive state. And now that they have retired and the society changes their perspective, it's like no more they are, no more they are useful, and we call them as dependent members. So this attitude matters a lot when we are talking in their terms. And third is social interactions. Of course, they have friends, but going to the friends, in a typical situation, if the daughter-in-law is working, the son-in-law or the son is working, and they are the ones who are supposed to take care of the children, the grandchildren. They are the ones who are supposed to have the responsibility of the home. When do they do their social interaction? When do they go with their friends, their colleagues? So these factors impact are more important, which somehow we neglect. When we treat a patient, our function is mainly, okay, you have knee pain, you have limited mobility, you have limited strength. Let's look at these influences. but we do not look at the factors of, are you able to pursue what you like? Are you able to look at your recreational activities? Are you able to meet your friends? And this is something that we tend to miss, which is extremely important from our point of view. We say there is a paradigm shift. As said, the number of aging uh, members are higher, the growth in the community is higher, there is increase in life expectancy, but as we said earlier, there is also an increase, unfortunately, in elderly abuse and suicide cases. Because the fact that I am no more useful, I am a burden, I am on dependent on somebody itself at times is very killing. And not to forget the fact, OTC concepts. Apne yahan we have a lot of polypharmacy domains. You, if we look at an elderly individual, normally they are on at least 6 to 7, 8 medicines at a time. Maybe not at least in a day. सुबह के अलग, दोपहर के अलग, शाम के अलग, diabetes, hypertension, vitamins and digestion and this and that. I mean, these are very, very detrimental towards the functioning. In fact, now newer norms say that more than 5 medications in the day should not be prescribed. But then, unfortunately, they are done, and they are still done because the general thought is that you have to take care of so many ailments in them. So why did we think of having these components? The vision of having this geriatric physiotherapy series, initially this was dedicated to be a single day conference.
Instead of
As we
INSTEAD.
uh, may I just request the participants to kindly have their systems on mute, please? Thank you so much. So the component was, instead of having a conference, the COVID scenario had us changing, and in fact, it put us to an advantage where we could actually reach to a larger population. The concept was to have a multimodal physiotherapy care, a geriatric care, incorporating specialists. Like we already talked about the overall number of speakers, and all of them are doing exclusive or a lot of work on geriatric care under different domains. We also wanted to have a better understanding of the physical, mental, social, and economical domains that the elderly have, and also help to have a better physiotherapy care for the well-being of the elderly. Now, we again were talking in terms of aging, we were talking in terms of healthy aging, and now we are talking in terms of successful aging. Aging is a natural process. We all age right from the time of conception. There's development, there's maturity and all. Healthy aging is a process of developing and maintaining a functional ability. So when we look at an elderly individual, how is your strength, your flexibility, your body composition, how is your fitness, your aerobic capacity? So these are important domains. Successful aging is how you are accepting that aging, how you are looking at a behavioral process to get the best. How are you enjoying life? How are you actually dealing with each and every domains that are very important in your life? So you may be fit, you may be healthy, but you are not meeting your friends. What's the big point of having such a life? So successful aging is equally important. So why was there a need to shift? When you are talking of optimizing performance, we all know that life itself gives us 4 different domains. So we talk of a healthy life, a fit life that has to have a good self-esteem, good confidence, self-respect, self-sufficiency. Honorable PM has said about being Atmanirbhar. How are you able to do things? If you are not able to do things by yourself, that still is a major thing. And one of the drawbacks in our culture or a society is, I am an elderly in the house, I should order people. मेरे लिए पानी लाओ, मेरे लिए चाय लाओ. Why? Because I should not move. And if somebody tells me, ki, grandpa, can you get me a glass of water? ऐसा कैसा? How can you talk to your grandfather like this? But see, movement is important, and especially for the elderly, movement is more important. We somewhere tend to forget that self-dependency is more important under that influence of traditions and cultures. Next more important domain is physical well-being. Your fitness, your ability to do tasks and activities, do whatever you want. And not to forget the cognitive domain. Are you functional? Are you still active? Are you still doing what you want to do? Are you playing with your brain? Are you thinking? Are you involved with your likings also? And when you look at all these domains together, we look into the components of fall prevention, memory components, and any other factors which are an obstacle to your functioning or independence. So yes, as a physiotherapist, as a specialist in movement, we all know that physical activity is the most important, but it is still most boring. Who wants to do? We so nicely tell our patients, okay, clinic mein, okay, take your hand in, take your hand out, take your hand in, take your hand out, take your hand. I mean, boss, think of something else. Why do we just need? I understand an acute care scenario where a guided movement, a obstructed movement is there, and you really want to have a clear mobility under a lot of precaution and care. But you have to think beyond. You want to know what would they like to do, what would they enjoy. For example, when we have our geriatric care activities, at times just playing certain games, of course, which are pre-designed and planned in order to get their mobility or cognitive function or components is equally important. So give them what they like. That is most important factor. When you do something, it should be fun. Having a team, having people together is really good. How do we do it? So, of course, social interaction, have an intrinsic happiness. Stop cribbing, start enjoying. Have a positive domain in life and thank people who are there in your life. This is something very, very important. Of course, as we said, we have a very rich panel of speakers who are going to talk on a lot of things. So my work is very easy for the day. I have to kind of just give an overview, and I have the specialists who are going to talk on all these domains. We talked of active aging. It reflects the desire and the ability of many seniors to remain engaged, very sorry, and be socially productive. So as a senior citizen, make sure that they are not dependent and they are socially active. Look into their issues and involvements. Look into volunteering activities. For example, my mother is a retired teacher and now she does not want to do anything. Okay, take free tuitions, free classes of children around you. Tell stories. Give them some moral values. Even that is more very important in this component. And of course, a small child will always nurture the care of a grandparent much more than what he or she would do for their own parents. So active aging is very important, and it should include work and leisure also. It's not just that you are there in the kitchen, you're working and all. What makes you happy? Okay, not sitting in front of a TV and watching your favorite soap operas. I mean, I'm very sure people enjoy it. That's not what active aging is all about. So as we said earlier, we have normal aging where we talk of disease and problems and all, and which we are accepting. Okay, you are 60 and you don't have diabetes. How come you don't have diabetes? I mean, why? Why should you? If you have follow good lifestyle, if you have influencing your lifestyle decisions, have a good life. Don't go into the domain of senescence where you actually are getting involved with multiple factors. Your core components of active aging should include maintaining high level of physical and mental functioning, minimize risk of disease and disability. How can you take care of this? And very important, as we have again and again and again said, social inclusion. Never ever forget the domain of social inclusion. In fact, we were so happy that we have certain clubs, like we have clubs for the knee also, where most important domain is of course exercise and fitness, but social inclusion, getting together, smiling, happiness, that itself is very, very important in this domain. So how do you live long and well? Yes, having good family tie-ups is very important. हम साथ साथ है तो हम सबके लिए बहुत जरूरी है. Okay, so have a positive relationship with others. Talk good, think good, do good. Look at positive things in your life. We generally tend to say अभी 2020 में क्या देखा हमने, सब कोविड ही तो था. No, but कोविड में भी कुछ अच्छा हुआ रहेगा. There must have been some changes, some togetherness, some happiness, try and look at goods in the things. Hope for a brighter future, especially for the elderly, because they don't have a few, they don't see a future. I'm not saying they don't have. So look, show them the positive sides in life. Doing good, what will be the things that they are going to gain out of it? So having a positive life attitude is something very, I know I'm sounding like a Babaji today, but what is important from all these domains is how much positive aspects we are able to keep in our life. And this is very, very important. There are certain themes. This is all that my talk is going to be about, and we are going to stop at that, of course, after we talk on these domains. Compassion, diligence, beliefs and social ties, networks or ties with smaller networks, hopes of the younger generation. What do they feel that they should achieve? I did this. What should my new generation do? Acceptance of self and life, perceived control, and precious moments. We are going to have a brief look into it at a later domain. So, because we are talking of themes at active aging paradigm. So, very important is involvement in life expectancy, employment, and strengthened pension system. This is something that we generally don't talk in terms of aging, but we have a very good speaker on this. Identifying the needs of fitness and prescription of exercises. Again, we are going to talk about this. Planning on age-related health, mental health, and long-term care. We are going to talk on this. Social engagement and recreations. Cost-effective interventions and technology. We actually don't look into technology because older people are not productive. Why should we invest in them? It's a wrong concept. Technology has to be, in fact, they are the most trainable, malleable, and adaptable population. So having a technological aspect for treatment of an elderly population is a boon for all of us. And very important is preventive and restorative strategies. So what are these? As we said, life, active life expectancy. So already मैंने बहुत इस पे ही बात कर रहा हूँ कब से कि how to be positive, how to expect things from life, how to actually look at improvement and life. It's not that now I'm 80 and now there is nothing more for me. No, now I'm 80. What is there for? What am I going to do when I'm going to be 120? Let's look at it. So look at decrease in the prevalence of physical disabilities, how increasing wealth and education of seniors, their change and improvement on technology and treatment can cause a change in their functioning. Very important domain, reduction in smoking and other disability related risk factors. In fact, there's just this new concept, that new information that COVID itself has reduced more than 1 million smokers. More than 1 million smokers have given up smoking in the duration of COVID, which is a very positive note. Improve in the nutritional status, increase use of assisted devices, fall prevention. Again, older generation का ये होता है कि if I'm using a walking stick and what if मुझे उसकी आदत लग गई तो, I mean, how does that matter? As long as you're functional, as long as you're mobile, it is much more important. Plus, environmental modifications are equally important. We are talking in terms of employment opportunities in the aging and strengthened pension systems. We know that there is decline in the labor force production due to interaction of personal choice. Many of them prefer to retire. Cultural norms, most societies expect them to retire. Business decisions, many people think they cannot produce. And government policies, 58 government service, retire. 64 education service, retire. So there are certain policies. Then there are employers' attitudes about older workers. He has bimari, he will be lazy, he will not be productive. There might be certain notations. There are some certain semi-professional health services which help provide employment for relatively. So wherever possible, there are agencies which are involving elderly people to work, to be more productive. There is need for change in the attitude of public and private economic and social institutions. They have a, elderly people have a rich experience which can always be looked and used by the younger population has that strength, that vigor, that vitality that can be used with the wisdom of the elderly individuals to get the best components. So a broader microeconomic policies need to be worked on, boosting the capital through strategies and reduction in government deficits. Again, we have Dr. Ashok Kumar Patil sir who is going to talk on these systems. We need to identify our roles in prescription, in assessment, and in treatment of exercises and interventions. We all know that seniors are at a great risk of needing health and long-term care services. There are healthcare components that need to be looked on, and plus, there are insurance components are very challenging in elderly individual. When we actually talk of how policies can be made, how insurance components can be made, because we say that as you are aged, your premiums are high. Okay, that itself puts a financial burden on a person who is not very well to do or so. So giving priorities in health promotion and disease prevention is very, very important. And we have three esteemed speakers, Dr. Anita Basuraj, Dr. Kavitha Raja, and Dr. Anu Arora, who will be taking care of these issues of prescription of exercise, biomarkers, and need for a healthy fit life. Planning on mental health, on long-term needs, role of the caregivers, because as we have said earlier, depression is a major domain, and self-sufficiency, one very important domain is be with your family. Okay, be together. If you have a spouse with you, I mean, that's a very good way, and I think the best bonding always comes at a later stage of life. But use challenges. For example, again, many elderly individuals are not very comfortable with using technology, with the Zoom system, the WhatsApp and Facebook, net, internet, computers. That education, that component is equally important. And when we are talking in terms of a caregiver can be a family member, a caregiver can be a paid member. But their role in the caretaker or in the domain of elderly management is equally important. We will have Dr. Shyam Gandhir sir and Dr. Abha Dukkar ma'am who will be talking on the components in more details. Again, social engagement, involvement in tasks and activities. Having their role as a volunteer, family carer is very, very important. So involvement in different roles, maybe a volunteer task, maybe a paid task, is very, very important. And why it is important for social engagement, how being together, being a productive part of the society is very essential. Dr. Chandu Basuraj sir and Dr. Asauri Peter ma'am will be talking a lot more into these further domains. Cost effective treatment, especially treatment of chronic diseases, technological aspects. We have earlier also said that non-communicable issues and especially lack of physical activity is a very, very important domain. So how can technology be used? What are biomedical and behavioral researches? It's not just physical domain. How can you actually involve mental factor, and technology for mental domain is something which is very, very important. Myself and Dr. Nitin Nikhade sir will also be talking on this at a later stage when we'll actually talk of how chronic diseases and cost-effective treatment and technological aspects can be utilized in a better therapeutic factors. And of course, what do we do as a physiotherapist? Where can we play our role? So designing specific programs and activities for maintenance of mobility, maintenance of functional independence, safe environment, therapeutic environment where the elderly can be more productive, not to forget their own zone, their own comfort zone, that is their home and their outside mobility, that is the intrinsic and extrinsic environment. That is also very, very important. Teaching specific appropriate strengthening and aerobic factors. We will have Dr. Mayur Revarkar sir and Dr. Manisha Rathi ma'am who will be talking in more details on these terms. And very, very important domains which will be handled by Dr. Radhika Patil ma'am is on balance and fall preventions, where a lot of emphasis for a healthy aging needs to be given on adaptation or adaptive equipments, protective equipments. One good thing for my talk today is that my all the consequent speakers are the ones who will be actually talking on the shift, the change, the need for a healthy aging. So when we are saying the movement for a better health, so these are a lot of factors will actually be dealt with the respective honorable speakers who will be talking on further terms. And whether is it only the therapeutic or the clinical domain, or can there be better research perspectives? What are the latest trends? How can the elderly be more productive, be what can be the health challenges that they have, how can that be prevented, how can population based disease domains be handled in an effective way, is what Dr. Nehal Shah will be speaking on, where our role in research aspects on numerous, because if the problem is in elderly individuals, we generally talk in research in terms of normative data, and there is a lot of variability. So having good quality standard research in elderly population is a very challenging notion. So how can that be handled? How can fall prevention, cardiovascular care, osteoarthritis and osteoporotic domain, how can this be managed is a very, very important factor which will be dealt in an efficient manner. And not to forget, there are two very important days that are dedicated for the health of the elderly. And I am a bit selfish. I have taken both the days for my talk. I'm sorry for that. But that's something that I love to do, because talking on the health, having a motion, having a move for propagation of the health of the elderly is very, very important. So the National Senior Citizen Day and the International Day for the Elderly People on 1st October, this is something that we will need to, it's an appeal that as a physiotherapist, just don't celebrate these days. Make sure that we are having something productive being considered when we are going to talk in terms of the elderly population. So do we really become old when we talk of become old? We have people who are beyond 50s and they are going into their 60s. And who will ever say that these beauties are the ones who have crossed their 50s and they are still the ones जिसको देख के हमारा दिल धक धक होता है. So aging is never a challenge. Aging is a next step. It's a step to take a step further, to move further in life. Or there are the young and dynamics who who are in fact the plethora, who are in fact the role models for fitness. So you don't even say who amongst this is the younger one, who amongst this is the older one. So aging can always be graceful, aging can always be fitter. And not to forget our evergreen Dr. K. Sancheti sir. Dr. K. Sancheti sir, he is Padma Shri, Padma Bhushan, Padma Vibhushan. We all know him for his extreme research domains, his work on patients and everything. And he's 82 now. What does he do? Does he talk? And why I just want to talk about him is he is a brand ambassador for health and fitness. I'm just going to show you one or two videos, and I hope sir does not kill me for showing this on the public domain. This is Dr. Sancheti for you. So he's not only the one who is doing those research work and clinics and patients and all. He is a brand ambassador of fitness. He is enthusiastic. You meet him, he talks about work, he talks about everything, and he also talks about what else, what other exercises should I do, what are the good ways. Can you tell me something good in Surya Namaskar? Okay, for most of you will say, अच्छा, ये exercise तो ठीक है, इसमें what is the great deal about it? Okay, this is what my boss does. And this is what I'm very happy to show you. I can't say it because I'm kind of mesmerized with what he does. And this is what we say, be fit, do what you do the best. So it's always important. Growing old is going to be mandatory. All of us are going to, become old one fine day. But growing old is it's an option. Do you really, you all will grow up, but are we going to grow old? That's how life will tell you. How do you enjoy your each and every moment? This is my aging mantra. This is what I always say. I'm a big fan of Shri Amitabh Bachchan. And I just want to say, if you want to age gracefully, have chini come so that you can be 102 not out as well. No, जो भी आपको मतलब निकालना है, but that's what the mantra to life is all about. So I really would like to thank the organizers, of course, that includes me also, just kidding, and all the participants, especially our speakers who have very much acknowledged to contribute to the knowledge to all our esteemed audience over here. And we are, I guess, ready to take any question answers if anybody is willing to have. Of course, please understand most of your questions will be answered in this due course of the webinar. So till we have the last session, we will have your question answers done. If you have any queries or any doubts, we have you all are on the group, on the webinar group, WhatsApp group. We can have the questions there also. So we can put those to the speakers in advance. And if there are any queries or any questions, we are open for that.
Thank you, Apurv sir, for the wonderful talk. Since I could not complete the introduction because of, I guess, network issues, I would like to do so right now, quickly, so till the time people frame their questions. So sir is also the author of the Shimpi's SI joint test and has recently been awarded the Innovation Award by Nehru Science Center, Mumbai, under the National Council of Science Museums, Government of India. So yes, it was a very informative talk. So quickly, can we have few questions from the participants? You can unmute and ask.
Hello. Hello.
Yes, ma'am.
Yes, sir. Sir, will we be having any topic about nutritional issues in elderly?
Ma'am, that's really a very nice suggestion, and I wish we could have taken that because we have certain experts who are willing to talk on that. But because
Okay.
the emphasis was more on physical domains of health, I agree that nutrition is a very important factor or chapter. But since the entire emphasis was more on physical factors, we have kept the focus more on physiotherapeutic aspects. So
Okay.
your suggestion is really very appreciable, and I think we would include that whenever we have further sessions anytime.
Okay, sir. Okay. Thank you, sir.
Thank you. Well, I believe that most of us are now holding our questions to be asked to the oncoming speakers with their specialty topics. So I, on behalf of Sancheti College of Physiotherapy, our management, our executive director, Manisha Sangvi ma'am, our principal, Vivek Kulkarni sir, and the entire organizing team, thank each and every one of you for your participation in this session. And I'm very sure that all of you will have a lot of enthusiasm and you will learn a lot in the coming weeks when we hear a lot from all our speakers in the next coming days. Please be in touch, have your questions, ask your questions in advance, and thank you once again for your participation. Thank you.
In case we still have any questions, you can, like sir said sometime back, that you can share it on the WhatsApp group where all the participants are there. So thank you everyone. Thank you for the patient listening, and meet you all again on 28th of September when we'll have a talk by Dr. Ashok Patil sir, who is principal in SKN College of Physiotherapy, Pune, on aging and employment. Thank you all.